So today I'm going to talk to you about a little bit about the immunology of MS. And the reason why that's important is because a lot of the therapies that are out there for patients with MS target the immune system. So it's important to be empowered and knowledgeable about what we think the immunology of MS is so that you can choose the right treatment for you. So MS is a complex disease, as is most autoimmune diseases in general. There is a genetic component. Most patients with MS have some genetic predisposition to get MS. Just because you have those genes does not mean you will get MS, but you are predisposed. There's a strong environmental factor that when combined with these genes makes your chances of getting MS a lot higher. A good example of that is patients who live above the 40th parallel have a much higher chance of getting MS, and we don't really understand why. There's obviously a major immune component in MS, and something goes wrong with the regulation of the immune system that's normally in place to keep you protected from attacking yourself. That dysregulation may come from the genes, it may come from the environment, we don't know. But all three of these things have to come together in order to develop multiple sclerosis and also autoimmune diseases in general. So the top graph is basically what a normal course of MS looks like. The stairs going up are relapses, followed by remission. And in most patients, but not all, eventually the disease enters a progressive phase where there no longer are remissions, you just gradually get worse. In the middle, the blue, I can look up here. The blue shows where the immune component is. The strongest immune component appears to be in the very beginning of disease, before you hit the progressive phase of disease. As the immune component starts to go down, what comes up is the neurodegeneration, and they also say and or central nervous system compartmentalized inflammatory injury. So what that means is when they look at your blood as you enter the progressive phase, it looks like your immune system is calming down. But what could actually be happening is that it's not calming down at all, but it's very active in your brain, and it's compartmentalized to the brain. So that's a really important concept about what we know and we don't know about the immunology of MS. So I'm going to tell you about some immunology and what we know and what we don't know. The first here is that these are all the organs associated with the immune system. As you can see, there are many. The problem with this picture is that there is no organ of the immune system in the central nervous system. So what that means is that your immune system, it does not normally live in your brain, is entering into your brain and kind of setting up shop. And that's a problem. There are many different cells of the immune system. The cells to your left are what we call innate immune cells. There is data out there that these cells have some role in MS pathogenesis. The function of these cells is your first line of defense against any invading pathogen or even yourself. They act very quickly, they act non-specifically. A lot of times when you have a viral or bacterial infection, it's these cells that clear it before you even know that you're sick. On the right-hand side are your adaptive immune cells. These are B and T cells. These cells are responsible for long-term immunologic memory. So when you get vaccinated for any vaccine, flu vaccine, it's these cells, the B and the T cell, that are the most important cells for protective immunity. And it's these cells that appear to be involved in the pathology of MS. I'm not going to talk a lot about T cells today, but the one thing you need to know about T cells is that they're called T helper cells, and what they do is they function to help other cells, and they do that by secreting soluble factors that act on other cells to help other cells be pathogenic. The reason why I'm not going to talk a lot about T cells today is because we think that the data for the immunology of MS is going toward the B cell. There is still probably a group of individuals in the US who strongly believe that T cells do have a component in MS. So, how do we know that B cells are key players of MS? I have to give a disclaimer here. I'm not comparing drugs on their effectiveness here, and there are some drugs that people are on that are not up here. And a good example is Copaxone. And the reason why that's not up here is that Copaxone has effects on so many different cells, including innate and adaptive, that it doesn't fit in this chart. The purpose of this chart is taking therapies, the most specific therapies that we have, and using that information to try to figure out which immune cell is the most important in MS pathology. So there's Rituxan or rituximab, which depletes B cells and only slightly reduces T cells. And it appears from the clinical trials that this is the most effective therapy we have to date. This drug is not approved yet, okay? There is Tysabri or natalizumab, and Gilenya or fingolimod, and both of those function to keep B and T cells out of the brain. They do so by slightly different mechanisms, but that is their function. And then we have the T cell therapies, which were called anti-CD3 and anti-CD4. Those drugs were in the clinic, and they depleted just T cells. They did not work at all. They failed, okay? But everything else that has a B cell component and the most specific B cell therapy is what works in MS. So given the clinical data, it suggests that B cells are the most important players in MS pathology. So I'm going to tell you a little bit about B cells, and this is going to help you to understand the therapies that you're on. And there's going to be several other talks today where people are talking about therapies, and this sets up the background information for you so that you understand. So B cells, there's this common misconception that B stands for bone marrow because B cells come from the bone marrow, but that is not true. B stands for bursa. It was first discovered in birds and it's discovered in the bursa of Fabricius. So that's a little tidbit of knowledge you can have when you're playing trivia. This is an electron micrograph of a B cell. This is what a B cell looks like. It really is a perfectly round ball. And on its surface, you can see is so many different processes. These are different things. This is how the B cell communicates with other cells. This is how the B cell exerts its function, is through all these processes on its surface. So I think a lot of you probably already know that one of the functions of B cells is that they make antibodies. And part of your diagnosis includes the presence of specific antibodies in your cerebrospinal fluid. These antibodies come from B cells. Antibodies can be beneficial and be very important for immunity. They'll neutralize pathogens, and they're important for vaccines. They also can be bad, and the antibodies are bad when they're reactive to self. That leads to autoimmunity. So what is the role of antibodies in MS? The jury's still out. I put up this one statement, which is that we know that the most effective therapeutic treatments to date do not reduce the antibodies in the spinal fluid of MS patients. So are antibodies important in the pathology of MS? Are they a cause or an effect? I would say we don't know, but if I had to guess from looking at the clinical data, I would say they may not be as important in the pathology as we once thought they were. They are probably an effect. We don't have data to support exactly that. We're just extrapolating that from the clinical data. So what else do B cells do? So B cells communicate with other cells. I like to call them the traffic light. They tell other cells, immune cells and non-immune cells, to stop or to go based on a lot of different things. Those processes that I showed you in the picture, they communicate with other cells through those processes. They secrete these soluble factors that act on other cells, and they tell other cells, go, don't go. They can communicate directly with the central nervous system cells and cause damage. And I'll show you that data in a minute. So I want to tell you a little bit about the cells of the central nervous system. These are the cells in MS patients that become damaged. And because of that damage, that's where you may feel fatigued or have a cognitive decline. So you have your neuron, which is the building block of the central nervous system. That is absolutely important and required for all connections you have in your body. Wrapping that neuron is myelin. And myelin is made from oligodendrocytes. The myelin keeps your neurons strong and allows these quick, rapid interactions between your neurons. When the myelin goes away, you don't have those quick reactive interactions anymore, and so everything slows down. The neuron eventually can be damaged. Astrocytes are what I like to call the nurse cell of the brain. They're extremely important. Without astrocytes, nothing functions. What they do is they provide all the nutrients that your oligodendrocytes and your neurons need to work properly. They have a lot of other functions as well. They maintain the blood-brain barrier, but they're a very important cell. Your microglia is your only resident immune cell, and what its job is to serve as the policeman in the immune system. It walks around and surveils the central nervous system all the time for invading pathogens. You would be surprised at how many times you've had an invading pathogen, a virus or bacteria, in your brain that you never knew you had because the microglia took care of it. So they're very good at their job. Now, when the microglia go bad, everything goes bad. You get a lot of damage in the central nervous system. So you have your immune system and your central nervous system. So how does this all come together? So I'm going to show you a picture of some data about the effects of B cells on your central nervous system. This is what it looks like. So this is a brain slice. In green is your myelin, which again wraps your neurons and is very important. Your astrocytes, the nerve cells, are in red, and your neurons are in blue. In the top picture, these are B cells from a healthy control, and you can see that the neurons look good and healthy. They're nicely organized. You can see the nice web of astrocytes, and then you see your myelin, which wraps the neurons. This is what a normal brain looks like with normal B cells on it. If you take B cells from an MS patient on the bottom, the story's a lot different. If you start at the neurons and look at the disorganization of the neurons and how they're destroyed, something changes with the astrocytes. We don't know what that is exactly, except that they're different. So there's some sort of change, probably in metabolic support to these cells. And you can see now that the myelin is completely destroyed as well. It no longer is wrapping around the neurons. So the biology of MS is very much something about B cell interactions with these central nervous system cells. So this is a summary of what I've told you today. the clinical data suggests that B cells are the most important. There is some people out there who still believe in the T cell story. There are still some therapies that are being made directed towards T cells, so I kept that in this picture. So you have B cells and T cells. Either way, it's adaptive immunity. Something happens. We don't know exactly what it is that happens that causes these cells to cross the blood-brain barrier where they're normally not there. In a normal patient with no inflammatory disease, there's very little B cells or T cells in your brain. They cross the blood-brain barrier, and then what happens in the brain still is sort of a mystery. It's very hard to study MS. As you can imagine, we can't walk around pulling live brains from people with MS to study what happens in the brain, which is why studying this disease has been so difficult. So in the brain, we don't know exactly what happens. We don't know if the cells come in from the outside and they're ready to go, or if they get into the brain and then there's something different about the environment of the brain in an MS patient that interacts with the immune cells in a way to cause them to for the destruction. So something happens in the brain, and the result of that is all of the effects that you guys see and feel every day, which is effects on your neurons, effects on your myelin, effects on the nerve cells of your brain, which also are involved in the blood-brain barrier. All of these things happen. You get blood-brain barrier breakdown because something happens with those astrocytes. They're not happy. So the paradigms in the immunology of MS is what we know is that the relapsing remitting disease initiates with some sort of aberrant self-reactive immune response. We strongly believe, based on the clinical data, that B lymphocytes play an important pathological role in disease. And the controversies, and this is a combination of things that we still don't know, as well as arguments within the field. What is the target cell of the B lymphocytes? Is it the astrocyte? Is it the neuron? Is it the oligodendrocyte? Is it all three? Is it none of the above? We still don't know the answer to that question. Are antibodies pathogenic? We still don't know that answer. Even though I said that the most effective therapies we have to date, the antibodies still remain in the cerebrospinal fluid, suggesting that antibodies may be an effect rather than a cause. We still don't know for sure if the antibodies cause disease or not, or have a role in disease. Do T lymphocytes have a role in MS pathogenesis? The clinical data would suggest not, but like I said, there are still a good camp of people out there that believe that T cells must have some role in MS pathology. A lot of those people, and I use this as well, so we have an animal model of MS. The animal model of MS is a T cell mediated model. It's not a B cell mediated model. So there are people out there that have spent 30 years of their life studying MS in the animal model. We use the animal model in the lab as well for certain things, because you have to for preclinical development of drugs. Over 3,500 drugs have been effective in the animal model of MS, and only about 3 to 5 of those maybe have been effective in MS, in human MS. So it's been a very difficult research track for studying MS, because our animal model obviously is not doing a good job of predicting what happens in human MS. So the camp out there that has a strong belief in T cells very strongly believes in the animal model. Is the progressive phase a reflection of more rapid neurodegeneration, or is there still an immune component in that progressive disease that has now compartmentalized itself in the brain. I've talked to a lot of different people in the field, radiology, people who've done histology on brains with patients with MS, and they say that they see a lot of inflammation in the brain in these progressive patients that you cannot see on an MRI. So we believe that there's still a lot of ongoing inflammation in the brain in the progressive phase, but again, it's a hard thing to study.